You're on, Randy.
Okay, thank you.
Showed up on my phone as it's watch live, so I'm assuming that means you're good.
All right, you're the host again, Randy.
Okay. Okay, looks like we got the chief here. And Candace is here. And Dexter is here.
Yep.
So whatever, Jim, whenever you're ready.
Yeah, you know what, it's 6 o'clock, all we're missing is Will. So we're gonna go ahead and start this with the call to order. I'm gonna read the agenda or the heading. This is the Public Health and Safety Committee held remotely on Tuesday, August 18th, 2020 at 6 p.m. as permitted by Executive Order 2020-07 signed by Illinois Governor J.B. Pritzker on March 15th, 2020 in response to the COVID-19 pandemic. To participate remotely, download the Zoom app or call 312-626-6799. Public Health and Safety Meeting webinar ID is 892-4375-2176. And the password is 599276. If anyone had any questions on how to do this, they were supposed to contact the city clerk. So we're going to call this to order at 6:01. Hang on, I'm writing stuff down here with a roll call. If I call your name, please say present. Klinker here. Carr?
Here.
Hill?
Present.
Here.
Oh, Hill.
Fahrenwald?
Present.
Okay. Johnson?
Present.
Cazares? He's not here, right? Absent. And Stevo?
Present.
Okay, thank you. And then we have Chief Rita's here. Is Chief Arzab on the phone?
Yes, I am.
Okay, thanks, Chief. Randy, we got
Yep.
anybody else that I need to know about? Okay. All right, so that's the roll call. I emailed everyone the minutes from the June 2020 excuse me, meeting. It was about a week and a half ago. Did anybody got any questions, or can we make a motion to approve those?
Yes, approve.
Second.
Motion by Hill,
second.
second by Fahrenwald. Any questions?
On a question, I never received a copy of the minutes.
You never see? Okay. I will, why don't we put this on hold until next month so you can get a chance to look at them. I emailed them like a week and a half ago, Al, so I don't know what happened, but I'll resend them, okay?
Okay, thank you.
This way we won't approve them until everyone gets a chance to look at them, all right? Is that everyone okay with that?
Yeah, that's fine.
Yeah, I'm okay with it. Go.
Okay, I will send them all to everyone again just to make sure. Okay, so next on the agenda is public comment. Public comment shall be by email only. Persons interested in making public comment must email their public comment to jklinker@cityblueisland.org by August 18th at 5 p.m. Email public comments received will be read during the public comment portion of the meeting by Alderman Klinker. I received one from Mike Cindy yesterday, the 17th. He says, first, can someone from the police department please explain the overnight parking ordinance number 2014-046? According to the Blue Island website, it states that the, quote, overnight parking ordinance that requires vehicles parked on residential streets from 2 a.m. to 6 a.m. must display a valid Blue Island city sticker, end quote. Attached is a screenshot from the Blue Island the Police Department's Facebook page posted on October 30th, 2014, which once again states, quote, a new ordinance was put into effect as of October 28th, 2014. The ordinance states that you cannot park your vehicle on any public street in Blue Island between the hours of 2:30 a.m. and 6 a.m. unless you possess a valid Blue Island city sticker, end quote. What is required so that vehicles can be parked overnight on a Blue Island street? Second, when and how does the Blue Island Police Department enforce/fine vehicles that do not display a valid Blue Island city sticker? Almost every block I walk down has cars that do not have valid Blue Island city stickers. Thank you for your time and attention to these matters. Mike Cindy, 2539 Oak Street. That's the only one I have. So with that, maybe we can discuss that when we get to the police chief's business. We'll go to fire department business. Chief Dan?
Good evening, everybody. Was everybody able to get their packets? Everything came through all right?
Yep.
Okay.
Yeah.
Yes.
Yep.
All right. We'll get started with the usual, the monthly update. So for July 2020, the fire department responded to calls accordingly, broken down respectively as listed: 305 EMS responses, 163 fire responses, 16 of which were auto aid, broken down again respectively by the towns we went to. Excuse me. Medical reimbursement, services collected in the month of July, which is also should be the second handout reflective of the whole year. But our monthly total for July totaled $29,613.01, bringing our year-to-date total to $267,867.97. We collected from fire recovery $1,806.24, bringing that total to $14,120.92. No false alarm fees in the month of July, and that remains at $700 for the year. Calls of interest was not too busy of a month as far as fire volume goes. Our EMS calls were up. Quite a few accidents compared to what we usually see, but we did have a truck fire on the 4th of July and some nuisance fires here and there. So that's broken down. Then on July 5th, so 4th of July evening, we went to Riverdale for basically a home explosion with our truck. That's when the truck was back in service. And then on July 10th, the boat and the 2111 responded to help state police with a battery recovery in the Calumet Saget, James and Ian. So like I said, relatively a pretty easy month as far as call volume goes, but nonetheless busy as it goes. General information, switching to page 2. As always, continuing to participate in the COVID-19 task force in the city of Blue Island, and then communicating with you folks on the city council and other elected officials, continually updating the Cook Lane Homeland Security, and having communication with them in regards to the happenings as it relates to COVID, the floods, the storms that we've had, the civil unrest that's come up. So been pretty busy with all three of those things here and there this last month or so. Also want to let everybody know that firefighter Joe Cook, who's also reported last month, was our EMS, had just accepted the EMS coordinator's position, is resigning. His final day will be September 6th, I believe it is. He's taking a position with the Naperville Fire Department. So we wish Joe well. He was here for a little over a year and some change. Helped us out quite a bit as far as EMS in the short period he had it. So he was very enthusiastic. I'm going to be sorry to see him leave in that regard, especially with some of the stuff we're talking about doing. So we'll open that up for the next man up in the department, and hopefully somebody steps up to that challenge and is able to offer the assistance that is going to be needed if we move forward. Maintenance wise, I know this sounds like a broken record here, but the tower ladder is still out of service. It was on its way back I believe it was last Friday, the Friday before, I'm sorry. And unfortunately it snapped a rear torque rod, and they are in the process of trying to get that apart and fixed as we speak. So I don't know how long that's going to be, but it was in service for about 3-4 days before we had the radiator issues. And then, like I said, it was coming back 2 weeks ago and had that happen. So unfortunately, that's going to be out of service for a little bit longer. 2113, the engine at Station 1, that was down for a couple days due to the onboard charging system that decided to stop working on us. So we lost the batteries and the charge. That was able to get fixed in about 2 days, which is good. We were running actually the 9th. I think some of you probably saw it on Facebook. We were running the 1994 Reserve Sutphin. We were down to two rigs fire suppression wise. So again, this is why we obviously talk about it here, but you guys have heard me mention it repeatedly, and we're going to have to look at this amidst many other things, the vehicle replacement, because we're, again, struggling to keep this stuff going. It's not a matter of if, it's a matter of when. So, and then Marine 2, I just ordered the parts for that, got approval from finance. So that should be coming. We should have those by Sunday, the parts, and hopefully back in the water on sometime next week. It can respond. It just cannot sit at the dock because it'll take on water. The bilge pump's not working. So that should hopefully be back in the water next week. And then 2162, the ambulance that we got from Posen, still out of service. It sounds as if they found the problem with that. It's again, wiring and electrical issues. So they seem to have pinpointed that, and that should hopefully be back in the next week or so there. So we'll have all 3 ambulances up for a short period, because then 52 has to go in shortly thereafter for the wreck that it got into back in June. So that's it for maintenance. Our fire prevention pre-plans, we continue to do those on Wednesdays. The shift crews go out and handle that. Training hours broken down for the month of July, 440 3/4. That should be number 3 in the packet. That's attached, broken down respectively for each individual in the department and the hours that they trained total and the subjects that they went over. Operationally, and I think I reported on this last week, but we're still on hold, awaiting the tower ladder. If that does not come back, obviously we're going to continue to operate like we have been with the 2 engines and relying on our auto aid for the trucks. EMS wise, again, continued preparations for the COVID response. We've taken on or received more PPE, excuse me, from the Cook County Department of Homeland Security. We continue to respond as we have throughout the duration of the pandemic in a manner that is safe for our employees and trying to give the best care to our patients as we can. So myself and Joe Cook, a couple others have continually or throughout the last couple months at your guys' request looked into, and we'll get into this under new business, but the upgrade to ALS. So we'll report on that here in a little bit. To close out the packet, as far as that goes, we have I have given you guys the overtime report for July 2020. The front page should be the total number, total amount, and then the subsequent pages thereafter are the breakdown respectively for the individuals on the department. And the last one in that packet will be the 7G program. So did anybody have any questions in anything that I reported on those things?
One, I guess, or whatever. And about the ladder truck. So it's been out of service, I guess, the better part of the year, it seems like to me. Is that kind of correct?
Yeah, Alderman Fahrenwald. It went out, I believe, August, almost. Yeah, it's a year actually coming up here. August 28th, I believe, was the date.
And so, of course, we keep spending more money on it. And I guess my question is very simply, can we just do without it?
I would like to say yes, but that's not going to be truthful. If we had, I mean, the nice thing with having, and I said this when I got here, there's always been a truck in the city of Blue Island. I think with the 2 firehouses, and even if we didn't have 2 firehouses, if we had the staffing to run an engine and a truck, it's optimal for us because we can efficiently get engine company operations started and a truck company operation started, and that the truck operations support what the engine's doing. So ideally, now you can have an engine do truck work certainly, but ideally the way we operate operationally, I think it's paramount that we have a truck in town. Again, I know that that's, cost wise, and I was hoping to have that, although he has not gotten that for me yet, the total breakdown of what that's costing. And I'm going to do that as we move forward through the rest of this year and into appropriations to give you guys kind of an idea of where we're at as far as the money we're spending, not only just on the truck, I mean, specifically the truck, because that's what we're looking to replace, but an overall breakdown of what we are spending on our maintenance, as opposed to if we can take that money and spend it elsewhere, meaning, i.e. payments for a new thing. I think that would be probably more worth our while at this point. So the easy answer is yes, we can do without it, but my answer would be that it wouldn't be in our best interest to do so unless we absolutely had to.
Okay, thank you.
Chief Reader, this is Johnson.
Yes, sir.
Just a question. With the Marine being down, do we have an intergovernmental agreement with the other surrounding cities for the Marine help as well?
Yeah, Alderman, we have we can call it dive box. There's Palos Heights has a boat. Mavis 19. There's various departments that have boats that can come up and down the canal. So yeah, and it's just not. If we have something that we need to get the boat in, we can. It just can't sit in. It can't sit docked because the bilge pump isn't pumping the water out and will sink the boat. So it can get on the canal and do what it has to do. It can't be out there for extended periods of time, and it just can't be docked at the time for the time being.
Thank you.
Anybody else have any questions? Okay, we'll move on. Chief, back to the under old business, I guess, ALS upgrade discussion.
Okay. Did everybody, I sent that a little, I was working on that, so I apologize I didn't get it out sooner, but did everybody get a chance to, or did everybody receive it first? And did anybody get a chance to look at the document I sent later this afternoon? Or earlier this afternoon, I should say.
I did.
I kind of skimmed it.
Okay. So the cover page is the memo. It's basically asking you guys for direction on how you would like to proceed. Gives an overview, which many of you know, obviously we're already BLS. We're looking to upgrade at the request of a few, actually several aldermen, the ALS options. So I broke it down. There's certainly going to, and I didn't get too deep into it because I knew we were going to discuss it tonight, but I gave two, I guess, of the best options possible. There's certainly other variations on this, but under options and recommendations, we can certainly look to, and when I say hiring 4 additional people per staff or per shift, that would be in addition to what we currently have. And what that would allow us to do is have 2 ALS ambulances available all the time. Now, certainly we can look at, again, I said variations of that. That would be the most costly because obviously we're taking on staff and everything else. You have the pension obligation, insurance, all of that stuff. So that's that breakdown. The second would be initiating what is called there's a silver spanner program, which allows for other IAFF firefighters throughout the area to come and work at a negotiated rate. And that's spelled out. I just gave you a rough estimate of what we could be looking at. Certainly that has to be negotiated and then advertised, but that gives those individuals that basically they come and work part-time until you get your department up to speed with the proper number of medics. We currently have 9 paramedics out of 27. We had 11 at one time, but we're losing. One actually had dropped his license a little over a year ago. Another one is Joe, who is actually leaving and moving on to Naperville, as I just discussed earlier. So that went from 11 to 9. So only a third of the department is currently at the level of paramedics. So when we talk about these things, and then later on in here, I discussed the domino effect of some of this stuff. So when we talk about upgrading, it isn't just simply buying 2 ambulances and all the equipment, and tomorrow morning we're ALS. I mean, that's the simple way of looking at it. And again, we can do that. But when you break it down across 3 shifts, that's only 3 currently what we have. We can only staff, or we only have 3 medics available for each shift. That doesn't account for people's time off, i.e. Kelly days, personal days, vacation days, sick time, any of that. So you're going to see an increased cost regardless, as far as it goes towards, paying for the staffing, whether it be in overtime, whether it be extra people. So, I mean, we really will have to drill down on hard numbers as far as what we're going to do as we proceed through this. I just wanted to give you guys a snapshot of where we're at and what we're looking at here. So they'll allow us, our system will allow us to run 1-on-1, at least initially. And what that means is, and I think we've talked about it here before, that will allow us to run one of our EMTs basic along with one of our paramedics, at least initially on an ambulance. So again, not accounting for time off and things that I just mentioned, hiring back people to cover that. The problem with that is again, if we have 2 ambulances that are ALS, that does not leave a lot of wiggle room for people being off. That leaves obviously 1 guy off a day. And that's, again, problematic in the way of if we're hiring back and whatnot. If we go that route, certainly you're going to probably see guys burnt out pretty quickly because they're going to be, we're a busy department. We run quite a few calls, obviously. So you're going to see a lot of guys burnt out. The potential for injuries are greater at that point, not only because of the burnout, but also because of the increased call volume on just a certain amount of individuals, whereas you're spreading it out where we, in the current model that we have over, a wider array of people. So the silver spanner will help us bridge that gap. The goal is to send our guys to school. Now, unfortunately, the problem with school is that, usually they run a fall and a winter and sometimes a spring class. Certainly since COVID happened or hit, they were able to graduate the class that was in there. But they did not start a fall class they're not starting a fall class this year. The next class will be January of next year. So we're delayed in getting people into that class. Now I've talked to them and they've assured me that now it's going to be a smaller class, but they'll have some spots available. Now, what that some spots is, my goal would be to try and send 4 a year, if not more, if we can. But I don't imagine they're going to give me more than 4 spots, and this would be through Ingalls. I broke down the cost for the class for those 4 individuals to go. And truthfully, to be able, I think it's a 3-year period. It would go 4, 4, and 3 to be able to get everybody up to, at the end of that period, it would be, 20, or I'm sorry. Yeah, it would be 11 and 9. So it would be 20 total of our 27 guys. In conjunction with the Silver Spanner and this sending our guys to class, obviously the next go around for testing for our entrance exam would include, or would have the requirement of paramedic, as far as those being hired, that we would only take those that are going to be paramedics. So that might help a little bit with that. But then again, that's relying on people that are leaving, which we don't necessarily want, and replacing them with paramedics. So that being said, I broke down some of the labor costs as well. These are all in the spreadsheets. Or I'm sorry, we'll start with the ALS ambulance item list. That should be the first. That's with all the drug box, the drug bag, all of that stuff. That's all the equipment that we would need to upgrade the 3 ambulances to ALS, just for equipment as it sits today. So there's a 25% fudge factor in there, just to account for stuff that we that may currently be on the rigs that we need to replace that we don't know about right now, or if we decide that we wanted to do something differently, or buy some of these things. There's certainly, this is I guess negotiable, some of it. The bottom line I would look at is the 158 is what the bare bone minimum is we're going to have to do. And if you guys, I sent an email about 2 weeks ago. It appears from what they sent back to me that the Cook County CARES Act money that we applied for, this will cover the cost of this stuff here. So this is the initial startup cost. Obviously, there's going to be costs associated with every year, just as there currently is, to replace this stuff and things of that nature. But this is going to be the initial startup cost, equipment wise, what we're going to be looking at. And it appears that right now that the CARES Act is going to be able to pay for that. We did, as a city, declare that we were going to use that money. If you remember back, that was, I think, $700,000 allocated. So we're still in pretty good shape as far as that goes. Should we decide to use this and go forward with it, we just have to, I believe, spend it by the end of this year. I know they're talking about extensions, but I don't know that they have extended it into 2021, or if they are going to extend it into 2021. So that's the equipment end of it. The next one was a brief, and again, we're going to have to get more with Topeka. And then certainly there's going to be negotiations into this. So, we're going to have to talk to the union and go through some of this stuff. But this just gives you guys, this is the labor costs associated with the ALS upgrade. Again, the paramedic school is going to be $5,500 a student. We're totaling 11 through the course of 3 years. So that's going to bring a total of $60,500 just for school for these guys. For the current medics, we're most likely going to have to offer a stipend to them. Again, that I conservatively wanted about $5,000, just saying, first glance, what are we looking at? We currently have the 9 that reflects that. That's $45,000. And again, as noted, will probably be will have to be negotiated. And then the Silver Spanner program, this was for three positions. So that's what that's how the hours are broken down. Okay. So that's 176 total, and that will be for a year to supplement. Now there's no bennies with the Silver Spanner. So the 23.55 an hour is I gauged it off of where we would be at if we're given I think it was the starting salary plus the $5,000 that came up with that. But that's just, again, a rough snapshot of where we would be if we're going to go ahead and do that. And that would allow us a little bit of flexibility. And then the unknown is going to be the overtime to cover their costs while they're in class, while they're doing practicals, some of that other stuff. So again, a lot of variables here. This is just, I think we're just really getting into this right now. And again, asking how far we want to go. That's, I think, the gist of what we're talking about here this evening. But that's the labor costs as I see it right now, projected. The last sheet that I gave you, or included in there as far as spreadsheet goes, gives you kind of gives you the breakdown. And we did this a couple of years ago when we talked about increasing our fees as it relates to EMS billing. But this gives you kind of this is our current medical billing company, and these are who they currently have as far as customers. So it gives you an average of what other places are charging, both for BLS and ALS. Obviously, if we're going to upgrade to ALS, which we don't currently have, we will be able to change our rate and reflect our increased cost to us. The I won't say the big one, but a large one that we didn't really affect us one way or the other previously was the mileage, because obviously Metro was in our backyard and we were really never collecting much money on mileage at all for that reason. But with the wear and tear on the rigs and obviously us going farther distances now, that mileage plays a little bit more of a factor in it. Is it huge? No, but is it something to offset some costs here? Yes. So that's something, certainly, I just wanted that to more or less for you guys to have an illustration of where we're at and what other places are doing as we move through it. Because if you look at the second page of the memo and additional information, the final paragraph there is just talking about our billing ordinance and how we may have to, or what we should probably be doing as far as changing or thinking the amount that we're charging for our services as we move forward. I mentioned too in first paragraph about the domino effect. Obviously, this is going to be a change to the way we operate currently. The ability, I think it's certainly well needed at this point. But I really think that at the very least, we should be looking at it. And I said this before when Metro closed last year, dedicated fires, at least one fire suppression company dedicated. And the reason I'm saying that is because, again, with the ambulances being gone for longer periods of time and going farther distances, we no longer have the ability, should a fire or any other emergency break out in our town, to have people back or be able to rush back from the hospital quickly to be able to get on that piece of fire apparatus and go mitigate whatever is being presented. So I think that, like I said, the very least that we should have one dedicated company, and that allows us flexibility with some of the other stuff, or at least gives us a fighting chance with one engine showing up and doing something to start to mitigate whatever issue is there. So like I said, that being said, you have 2 on an ambulance, 2 on the other ambulance at Station 2, and 3 on an engine. You're looking at a minimum of 7 guys. So again, that's where I say operationally and some of this other stuff has to be looked at as to what we're doing, and administratively too. I mean, I welcome the challenge. I'm very pleased, and I think we're doing a good job as a department as a whole. But not having an extra set of hands administratively is hamstringing us in some other areas as well. Because obviously with everything that's going on at once, it's as much as I'd like to think I can handle everything, there are things that do get missed unintentionally because I can only focus my attention on so much, and this is a pretty big nut to crack right now. But there's a lot of other things that, again, we could be doing or should be doing that if an extra set of hands administratively were there, it would allow that to get done. So it's just food for thought. It's things that we have to be looking at. And then the final thing, the second paragraph, the thought of replacing that 2004 Posen ambulance that we traded for street sweeping. Again, I think that was a stopgap measure when we did it. I think that was reported. I know that was reported. And we're looking at a $220,000 to $300,000 replacement bill on that. So I know that's not all good news, but I think it's the reality of where we're at. I am looking at potentially trying to get an ambulance with the CARES Act as well. I have not gotten a confirmation as to whether or not they will pick up the cost of an ambulance. There are other, I saw one company that is marketing a infection control ambulance for this, but I have not gotten the information back to say if it is in fact going to get covered. So that would be something, obviously, if we can pull that off, would be very helpful, because you're looking at all the ALS costs in a new ambulance is being covered, and we're still under our $700,000. So, that's it in a nutshell. I know that's a lot to digest all at once. Certainly, I'm sure you guys are going to have questions. I'm sure, or I would expect you guys to look it over. And with that, I'll let you guys ask away.
Anybody got questions?
Yeah, this is Alderman Carr. This is a point of clarification. When we first started talking about ALS ambulances, for some reason I was under the impression that we would need to purchase new ambulances, but it looks like according to this list, what we actually need to do is upgrade the equipment that we have on the ambulances?
That's correct, Alderman.
Okay, all right, thank you.
Anyone else?
This is Alderman Johnson. And first, I want to thank Chief Rita and the Alderman who backed us trying to get ALS for the city of Blue Island and the citizens. Something we hadn't done for the citizens alone in a long time. I think this is very valuable to us as a tool for many things. But, you know, with the closing of the hospital, I guess Chief Rita and I was on the same page that this was much needed, and the monies that was offered to us through quorums could have taken care of it, but maybe things happen for a reason. And so right now, Chief Rita found some money, free money for us to be able to get a lot of these things done. And I'm just saying, like, you know, Chief Rita, which would be the best possibility? It sounds like the silver until we can get fully loaded as far as, you know, staff to handle this. But I'm willing to look at your recommendations.
Yeah.
Go ahead, Chief. No, go ahead, Chief.
No, I was just going to say, I mean, that's why I put there's certainly other, you know, this isn't the end all be all. I wasn't going to get, there's no absolutes here. Certainly, I think those are the two best options right now. There's certainly, you know, without sitting down with the union and going through what they're maybe thinking. We've had some discussions here and there. Nothing, you know, nothing in depth, nothing, you know, concrete, obviously. So without listening or hearing what their thoughts are, as far as we building this out, I think that's at least initially how we would be able to best do this. You know, certainly I don't think even in the best year that we had the best circumstances, but COVID really threw, like I said, a curveball at us with the fact that we can't get people started sooner. And what I failed to mention while I was talking about the paramedic school, they're pretty confident that they'll be able to pull off the practicals, but one of their concerns is because the hospitals are not letting outside folks in still, that these students may not be able to get their clinical stuff done in time. So what normally takes, you know, 9 months to a year to get everything done, maybe extended even longer, which obviously doesn't bode well for us as we're trying to get this done quickly. So not quickly, but in a quicker manner than that. So it's going to be more of a marathon than a sprint. So to kind of piggyback off what Alderman Carr said, I mean, and I don't mean this in the way it may sound, as far as to just think that, you know, we order the equipment or we order ambulances and we hit the ground running tomorrow. I don't think that's a fair assumption, because it's not reality. So that's why I broke it down the way I did. And again, I know you guys are going to have a lot of more questions as we move through this. I just wanted to give you kind of a more than a brief overview, but kind of an idea of where we're at. And we can certainly, you know, with the help of the committee, go through what maybe you guys have some ideas as well, and we can certainly sit down and discuss those as well.
I've got a couple, Chief, if you got a second here. So
yes,
you got 11 going plus 9, that gives you 20. So there's going to be some guys that will not be medics. Is that what your plan is?
Yeah, I would think. I mean, we can certainly build it out even farther than that. That was, again, just to get us to the point that we have enough on each shift to be able to account for time off and everything else that, you know, that obviously, you know, goes with that. So
Sure.
that was the initial thought. You know, as far as going farther than that, some may be through attrition. Certainly, as we move forward, if we upgrade, like I said earlier, we're going to make it a requirement for anybody that's taken the entrance exam to have their medic license. So through attrition, whether it be retirement, people moving on to other jobs, we'll start backfilling that bottom half of it. So eventually, like with everything, you know, through attrition and everything else, will be a fully ALS at some point here. When that is, I don't know. Certainly, if we have the money or the ability to send more, we'll certainly, if we can, and with the support of the council, we'll send them, because the goal would certainly be to get everybody done. But I think 20 will give us enough people to cover time off, get 2 ambulances staffed, and do all the things that we need to do. But the end goal should be for us to be all ALS at some point, everybody.
Okay, so you mentioned talking to the union. I think that's real important too, because as I'm looking at your numbers and what you're projecting costs, you know, you're projecting overtime costs to cover guys so they go to school. I'm not sure. I'm guessing they're going to want to, if they're off duty, they're probably going to want to get paid to go to school too. So I think getting, you know, I really think this is a great idea. We just need to try and get with them and see what we need as far as better numbers, shall we say? I mean, this is a great start. I had a couple other questions too. So you said 1 and 1, they're going to allow us to do 1 and 1. That's, one medic, 1 BLS guy. Is that like for a year? I know that's what Bernie used to do, was give you a year to do that.
He didn't give us a time frame,
Okay.
Alderman Klinker. I know, and again, I wouldn't necessarily want to go. I think there's more value to having 2 medics, so I wouldn't want to extend it. I think that just based on numbers, we're going to have to do it for at least probably 2 years, realistically. But I know Cal Park's in year 2 and they're still doing it. Not that that's right, wrong, and different, but they are very, both him and Kim, I've talked to Bernie quite a bit. He's very excited. Kim's very excited that we're exploring this option, and they really want to help us succeed. So I think that as long as we're showing that we're making the effort, I don't think they're going to give us too much grief about that.
Okay. I just don't want to start something and then a year from now have them go, okay, now you know what I mean? And I,
Right.
so everyone knows Kim and Dr. Bernie, I work with both of them, and they're really good to get along with and really, really good people to work with. So that's shouldn't be a problem, but I'm just trying to look at projected things. So I know before COVID even started, a lot of medic schools were pretty much drying up. They used to run them. So everyone knows they used to run them. Christ ran them, Ingalls ran them. They were all over the place. And now there's less and less classes. So that's something. So that the only school that that's going to be open, Dan, is going to be Ingalls.
Right now, that's all I've heard. I'm sure Christ is going to have another class at some point. I think St. Mary's. I think everybody's going to probably have at least one, but like you said, they're all going to be scaled back.
Yeah.
So we may be able to get people in different places, but then certainly it comes down. I know Christ is, I think, a little bit more than Ingalls. St. Mary's down in Kankakee County is less. So again, it's just this was just based off of Ingalls' quick numbers. See where we're at. What we can do, but yeah, I think that others will have them. I just don't know how big they're going to be. As you mentioned, they used to take on big classes and quite a few, and I don't think that's going to be the norm anymore.
No, I don't think so. So, and just to hit on this again, so everyone's aware, this is like you said, a 9-month to a 1-year long program. There's a lot of hours involved, everybody, a lot of hours and the Silver Spanner thing, it's worked in other towns. I know it worked once when I was chief. I can't remember what town it was. But it's a very good program that works with the union's help. And we just need to make sure that the union's on board, and we need to look at any and all costs that are going to be involved before we go, full bore into this. If you follow what I'm saying, Dan.
Yeah.
I think it's a great idea. I think it's long overdue. We tried to do this 30 years ago when I was on the department, and it just kept getting shot down because we had the hospital in our backyard. We don't have that now. We need to do this. That's my personal opinion. We just need to make sure that we're dotting all the I's and, crossing the T's. That's all the questions I have. Does anyone else have any questions?
Dan, this is Alderman Stevo.
Yes, sir.
With the move to transporting Cook County patients, Blue Island needs to make the move to ALS because ambulances will be traveling farther distances and be gone for longer periods of time. ALS also adds value to the community. And I think the priority should be to get a new ALS ambulance to start. Thank you.
Anyone else?
It's Alderman Fahrenwald. Just got a couple of questions or thoughts. And I'd like to just first off completely support what the chairman said, which is that we need to do this. And we are the Public Health and Safety Committee, so we need to make sure that the health and safety of the public is protected. And I wouldn't say money be darned, because money is important and we need to look at that. But that at this point, I think we need to come up with a good recommendation, and obviously it's going to go to Finance Committee, and they're going to take it out, their own look at the numbers, and at least kind of starting out of the gate. I'm not going to be so concerned about just how affordable something is. We need to look more at what we really need to do, and I think that's critical from the perspective of this committee. But given that, I'll ask the chief, and again, this is out of complete ignorance. Is it possible or even legally permissible that we would have one ambulance in one station be ALS as a temporary measure to get us across the bridge?
Yeah, that was one of the things that, like I said, based on staffing, we may only be able to do one. I will check. I know Oak Lawn back in the day used to have a BLS, I think Chase car. I don't know if they had Jim, did they have an ambulance to BLS ambulance? and an AL. I know they had a BLS chase car, and I think an ALS, or I know an ALS ambulance, but that was one of the things. And even if we're down to one ambulance, now that being said, some of just the back, some of the, I don't want to say downfall to that, but that means that there's only one ambulance available. So if we're out, we're going to be relying a lot more on auto aid. Now, that being said, if we go that route, because that is some things that, or one of the things that I was considering as well, is that some of it's going to be based on staffing, that we can upgrade the engine to an ALS engine with one medic on there and be able to at least respond with our neighboring towns to be able to do that. So yes, that's something that we can certainly look at. That is something that was on my radar previously, but yeah, that's something that is definitely that can be done.
Thank you.
Dan, this is
Hi,
all. One more question.
Go ahead, Stevo. Go on, Stevo. I'm sorry.
Report about the hospital. Status of the hospital currently.
I'm sorry, Alderman Stevo, I didn't hear you. What?
What can you report about the hospital? What is the status?
I met with those folks, I believe it was 2 weeks ago. They were just giving me a status update. I think I previously reported, and I know we sent it out in the COVID task force meeting minutes, but the previous plan was to use the hospital, or the last reported one to you folks was a holding, a building to hold patients that were recovering, for waiting their return to their nursing homes respectively. That sense has been scrapped. When I was there 2 weeks ago, they're still in there, meaning the National Guard, the folks, the DuPage Medical Group is the clinical providers for the hospital. So, and they have a consulting firm in there as well that's helping them with the managing the day-to-day operations, as well as the building engineer company that's making sure obviously all the facilities are up and running. But as of right now, they are still on hold. So they've scrapped the nursing home patient holding building, if you will. And they are going to wait and see what happens with the fall and if there's another outbreak of COVID, as has been reported or predicted by some places. Then they will be potentially activated to start housing patients of some nature, depending on their acuity. As to what that looks like going forward, I don't know. I don't think they quite know, to be honest. So it's really just it's wait and see. But we have open dialogue. I mean, I talk to them via email or text or phone call, probably at least once every 2 weeks. We've had a couple meetings. Both myself and the police chief have been over there. So I mean, they have a plan as far as what they're going to do if they're told to do it. But the state really holds control over when and if that place gets opened at this point.
Thank you for the update.
You're welcome.
Anyone else have any questions on the ALS program?
This is Alderman Cazares. Chief, can you give me some clarification on how you will select the who will be the first four and the second four and the third three participants that will, sorry.
Yeah, as far as who's going to school.
Who's going to go first, and how are you going to go about making that selection?
I have a couple plans. I haven't gotten that. Some of that's going to has to be hashed out with the union as well. Some of my concerns I should say, some of the concerns that I have with just the younger guys is that we're going to be training them to leave to take higher paying jobs, which that's unfortunately going to be our I guess our lot in this crazy world of the fire service. But I would like to probably use a combination thereof. I think some of the guys that obviously have been here and aren't going anywhere, if they're willing to do it and want to do it, we're certainly going to accommodate them and send them because we know they're not going anywhere. Again, I think if we have some other things factored in, and this is where again the negotiation with the union comes in, if we can keep some of these younger kids, certainly that should be our goal as well. So I don't have a definitive answer for you because I haven't gotten that far. I've had several different scenarios playing out on paper, but nothing definitive at this time.
I'm pretty sure this is going to be a union question again, but there's got to be some type of guarantee or some type of incentive to, fulfill their obligation, especially if the city of Blue Island is going to be paying for school and education and overtime, like Jim mentioned earlier. There's going to be a lot of overtime. And if we can't get any reassurance that, these guys are going to stick around for at least 2-3 years after the fact that we've, taxpayer money has gone to train them. Now, don't get me wrong. I love the idea of training our own guys and keeping our staff to what is needed versus the silver lining. I do like immediate, an immediate solution to the problem, but at the same time, I personally would rather, take the approach that we should have done 10 years ago, as you mentioned earlier. Thank you.
You're welcome.
Yeah, this is
Anyone else?
Alderman Johnson. Yeah, this is Alderman Johnson. Alderman Will, I know we that's one of the factors, the reason why we put I guess giving them a discount or a down payment for homes in the city of Blue Island as first responders, was trying to do everything we could to make, us not being the top paid city around, but to give them also an extra incentive to stay, as well. But I just appreciate you guys finding the value and seeing the value of this ALS, because to sit and watch someone's loved one die and then watch our first responders do all they can with nothing, with straw, to try to build a home or something out of brick with just straw. To see them do that in person, and that person's loved one don't make it, and just for us to vote in order to have these guys with just an extra little help somebody loved one make it, I don't think you could put a value on that. And that's what I have to say. Thank you.
Thank you, Doc.
Okay. In an effort to move things along, because I know there's a judiciary committee meeting after this, is everyone in agreement that you're going to finance with this on next week, correct, Chief?
Well, that's what I was looking for. Yeah. Would you like, you want me to go that route?
Yeah, I think that's what you sent in an email, or you mentioned at the
Yeah.
last meeting that you'd like to talk about this at this meeting and then present the same stuff to finance on Monday.
Okay.
I put it down as a discussion, so I don't feel we can vote on it, but I don't think anyone's would vote against it anyway. But I think if we have a consensus here to have you go to finance, talk to them, give them the whole same plan, and maybe when I say we, you and Topeka can start, and the union maybe can get some better numbers for us. We have a little bit of time, because like you said, the class doesn't start until after the holidays. But obviously, if we want to get this going sooner is better than later, in my opinion, because if you miss that January start, you're going to wait again until the fall for another class.
Right.
Does that work for everyone?
That's fine.
That works for me.
I agree.
Okay.
Do we need to give a recommendation of what this committee recommends in terms of the options, or
Well, like I said,
numbers first?
I put it down as just a discussion, so it's
Okay.
kind of hard to vote on something. I didn't realize that, and Chief, you didn't even have it. I think you have it on your thing as,
Yeah. I just
motion.
put it as staff direction right now to see.
Yeah.
I wasn't. Yeah.
I think, unfortunately, a lot of it's going to come to money. If you do the option number one, it's going to be really expensive.
Right.
Hire an additional, was it 12 guys or whatever? I have it here in front of me.
413.
4 per shift, right?
4 per shift. So yeah, through 12 guys.
12 guys, yeah. So I think it's going to end up pretty much in finances, way. I can speak, like I said, for the silver spanner program that the IAFF has, and the idea of this is to help us become paramedics, our town, and also it helps keep some of their guys are doing this. Basically, I don't want to say a favor, but they're helping us out so that we can work into that. So it betters the IAFF in the long run as well. I think that's the goal of the program. So
Right.
I think what I'll do is just, if we could bring this up Monday at finance and see what they have to say, and maybe if you and Topeka and the union can get together and try and come up with a little bit better numbers. I know this is just kind of a ballpark that you're looking at here.
Right.
Maybe we can, put it on the agenda next month to, officially approve it, shall we say? Like I said, I don't think there's no one here against it, that I know of. So if that works for everyone, can we do that?
Yes, that's fine.
Agreed.
Okay. All right.
Okay.
So you have anything else,
Yeah.
Chief?
No, that's it. Thank you very much, everyone.
Dan,
Okay, so-
Alderman Stevo,
Yes, sir.
Go ahead.
once we train the new ALS, how can we guarantee that they'll stay here with us?
Well, that's part of what they're gonna have to figure out.
that's-
That's what
that's-
Bill was just talking about. And Will was also talking about. That's gonna end up also being in a union contract, more than likely, saying, you know, if we do this, then you're gonna give us X amount of months, or you're gonna pay us back. That's generally how these work, correct, chief?
Yeah, right. And that's what we're gonna have to, that's why I bring the union obviously into this. They're gonna have, I'm sure they're gonna have a say in how that goes moving forward. So yeah, I mean, and again, I think that I think you guys all know this. I mean, these guys bust their tails for this city, and they are committed. You know, it's just unfortunate some of these other places pay a little bit more. So I don't think it's going to take a whole lot. I mean, they love being here. They love the job they do. It's just, you know, sometimes it's hard, you know, to turn down some of that other stuff. So we have a good group, and they're willing to do whatever needs to be done. So.
Okay,
Okay.
so if chief's done, we'll move on to the police department business. Chief, Bernie? Still there?
Yes, can you hear me?
Yes.
Okay, all right, good evening, everyone. For those of you that have the monthly report in front of you, I will go through it. The items that have not changed since last month, I will skip those to do better timing here. Probationary, under administrative updates, probationary officer Puma, he's still continuing his training, and he's expected to graduate on October 2nd. Patrol officer Nancy Bailey successfully completed her 18-month probationary period. Our staffing level, just like last month, it's still at 33, which we should be at 37. The next eligible candidate on the full-time hiring list will be hired hopefully September 8th, and we'll go to the academy after that. Going to item item E. The department has begun the targeted enforcement of the Blue Island vehicle sticker and overnight parking ordinances. Item F, I attended the Suburban Major Accident Reconstruction Team quarterly board meeting on July 15th. The monthly reporting, you have your 4 attachments that you usually have on your report. The revenue streams collected for the month of July was $50,666.66. The calls for service going on to the top of the next page, 3,016 for July. 1,538 were calls for service by our officers. 1,478 were self-initiated by the officers. 3 firearms were recovered, 3 FZO deployments. There was 33 hours of training for the month, and then there was, minus the reimbursed overtime, we have $10,476.95 in overtime for the month. On going on the 3rd page, a lot of these things have not changed, so I won't go through them. Item G is we began training for the LexisNexis e-crash with our officers. The fleet is the same. Going on to page 4 on the bottom, for cases of interest, on July 11th, aggravated battery with a firearm in the 13300 block of Old Western Avenue, responded to a gunshot victim outside of a bar. Officers located the victim. He sustained 2 gunshot wounds to the buttocks. The subsequent investigation has produced persons of interest, but it is an ongoing investigation, and additional evidence is being collected. On July 13th, aggravated battery in the 2800 block of 141st Street, responded to the field area for a subject with an apparent stab wound. The subsequent investigation determined the victim was practicing football when confronted by the offender. The offender was armed with a knife and attempted to attack the victim. The victim disarmed the offender and used the knife to defend himself and stabbed the offender. The victim dropped the knife and stepped away from the offender. The offender recovered the knife and attacked the victim from behind, stabbing him. The offender was arrested and charged accordingly, and the investigation revealed the dispute was ongoing between the two that had begun several months ago but was not reported to the police department. On the last page, page 5, the community engagements. On July 16th, the annual College Scholarship Award Program for children of police officers and support staff was announced at the South Suburban Association of Chiefs of Police regular meeting, with 2 of the recipients being Blue Island Police Department members' children. Under miscellaneous, the ATV and mini bike offenders in the area of Broadway and Old Western were apprehended, and the vehicles impounded under the Administrative Vehicle Impoundment Ordinance. And the department conducted targeted traffic enforcement in the area of 140th Street, 140 Street and Francisco Avenue, yielding 11 traffic stops, 4 citations, and 7 warnings. And then the usual 4 attachments to the monthly report. Any questions?
No.
And then Alderman.
May I make a suggestion? This is Alderman Kess.
Yeah.
Yeah,
Yes.
Chief, do we have any images, photographs taken of the those ATVs, off-road vehicles, the impound? And if we do, can we ask our social media, the city's social media, to make a post as a reminder to the public that it is illegal and they will be fined and impounded and everything else that happens when you ride ATVs on the street?
Okay, sure. Yeah, I will definitely look into that for you.
Anyone else?
Just to add to that, I asked because even though you guys are doing a great job of stopping this, they keep popping up, Bernie. They keep popping up. It's like they're selling them for hotcakes off the back of somebody's truck because they are everywhere now. Thank you.
Okay. Duly noted.
Dex, you got something?
This is Johnson. Chief, I just want to thank you for so many things and so many reasons, but one definitely that you had extra patrol to come through and patrol the my first ward, and actually catching people running, just blowing through stop signs. I'm so afraid of the children down here that's playing in the street, that, you know, with these guys buying these Dodge Chargers and Challengers and these Camaros, that they're going to seriously hurt somebody. And I thank you for coming down, because the lady who did have a crash flew through the stop sign and ran right into a guy just dropping off his kids.
Right. No, yeah, absolutely. You're very welcome. It's our pleasure.
Alderman Fahrenwald.
Go ahead, Bill.
A couple things, Chief. One, I just want to say that probably, again, a compliment to what you do. Stickers. It seems like it's one of the hot topics I see on social media and around town, and there seems to be a feeling that we could do a better enforcement job with stickers, which probably we could always do a better job. But I gotta say, I do a lot of walking and I watch stickers, and for the most part, cars do have stickers. I do know that clerks this year, at least recently, we were 500 sticker sales ahead of last year, and it probably has to do with your enforcement efforts. And then, I would also like to say that we do need the police force doing their most important things first, and city stickers aren't. So, we can only have your resources doing so many things, and there are going to be some cars without stickers always. It's just the nature of the beast. And also, if I've had a good experience, if there is an area where I see or I get a complaint in my ward from somebody who says that a street has a lot of cars that don't have stickers, and I talk to you about it, and you're willing to do a targeted enforcement, and believe me, for several years after that block will have stickers. So I just think you're doing a good job there, and want to encourage you to do so. Also, I have a couple of questions that may be more for our city attorney, but I wanted to check with you. And Chairman, I know you and I talked about this subject a little earlier. That is of roosters. Chairman, I understand is it correct that there is an ordinance somewhere
So, yeah, it went through community development. It's actually on the agenda for the Judiciary Committee tonight.
Okay.
I don't know, the final thing was, I believe it was 10 chickens and no roosters is what I think the final was that they came up with.
Okay.
But yeah, so it passed through, community development came up with it, I guess, and had it drawn up by whomever, I'm not sure. And it's right now waiting to go through judiciary tonight.
Okay, thanks so much. That's great. And then the final thing, Chief, and again, this really may be for the city attorney, but you might know. Is there any kind, I had an inquiry from somebody whose neighbors are smoking a now legal substance and smoking a lot of it, and the odor is wafting across their property lines. Is there any kind of an ordinance covering that? I'm aware of one.
I thought early on when this was being passed in Illinois, I know there was one being drafted. I'm not sure if it was actually passed yet or not. I can't remember offhand from the attorney's office.
All right. Well, I'd like to
But
know.
I don't know if it specifically answers that type of a question though.
Okay.
And then I know it's one out if you're a renter, and the landlord doesn't sign off or agree to use the usage of it, that they can't smoke it in it. But if they're a homeowner, then that's another story.
That's a good point, Alderman.
Hi, this is Alderman Hill. I have to leave you guys because I have another judiciary committee. So, Chief, I just wanted to say you're doing an excellent job.
Thank you, sir.
Thank you. Take care, guys.
You too.
Okay.
That's all.
So Chief, back to, go ahead.
Alderman Klinker, I'd like to piggyback on what Alderman Fahrenwald said about the sticker enforcement.
Yeah.
And I know there was a public comment in reference to overnight parking and city stickers. So I just wanted to say real quick to make it a simple explanation. For the overnight parking, when it's in that violation time frame, what the officers do is when they pull up to a vehicle, they run the license plate on the vehicle, and our parking system is linked with our leads interface, which is also linked up to Secretary of State. So if the license plate comes back on any other town other than Blue Island, that vehicle gets written a citation for overnight parking. I cannot, unfortunately, answer for the Secretary of State on whether or not their information is updated in the system. Unfortunately, I don't have an answer for that. And then also with the city stickers, yes, we are, like I said in my report, we are doing the August enforcement. I believe we started on either August 3rd or August 4th. So since that date, so far for city stickers and overnight parking, we have almost 900 citations issued already.
Wow. So I guess the question that Mr. Cindy had based on his email was, the ordinance says you got to have a valid city sticker, and he's claiming he had a valid city sticker. So
well, in order to have a valid, and they kind of go hand in hand, and I understand where he's coming from, and that may be a conversation that he may have to have with Secretary of State, because, like I said, when we run the plate, if it doesn't come back to Blue Island, we write it for overnight parking because that's how the system is interfaced together. And then obviously we all know that in order to get a city sticker, you have to have a Blue Island address. So they kind of like go hand in hand, but I understand his concern. So if he's able to clarify that possible correction with Secretary of State, I'm sure if the ticket, the hearing officer would be able to avoid that ticket out. Absolutely.
Okay. I think he's listening tonight, so hopefully he's got an answer. If not, I can relay it to him tomorrow.
Very good.
Anyone else have any questions for the chief?
Stevo.
Go ahead.
Chief Arzab, this is Alderman Stevo.
Yes.
Where does it say in the ordinance number 2014-046 that your car has to be registered at your address? Where does it say that in this ordinance? And I'd like to know how many other tickets were issued wrongly. That's what I'd like to know. How many other tickets were issued improperly? Can you give me a number on that?
No, I cannot at this time. But if I have not had any other complaints.
Mr. Stevo, I have the ordinance up in front of me here, and it says overnight parking. No person shall park a motor vehicle without a valid Blue Island vehicle license, AKA sticker, on any city's residential zoning district between the hours of 2 o'clock and 6 o'clock.
I have the same ordinance, thank you.
Okay, I'm sorry, I didn't know you did.
But they had a vehicle sticker applied, a current vehicle sticker was applied. And still was issued a ticket. So there's something wrong with the ordinance.
So I think, and Al, I know you wanted this put on the agenda, and I said I thought it should probably go through judiciary. Maybe we could either go through judiciary or ask the city attorney at the next council meeting if he could clarify that.
Well, one reason I wanted on the agenda for tonight, Jim, was because I could have asked the attorney to be part of
I'm sorry, you're cutting out, Al. I can't hear you.
The reason I wanted on the agenda tonight was because we could have had the attorney perhaps be part of the meeting, and I could have answered this tonight.
Okay, well, that's when I answered you in the text. I told you that he regularly attends the judiciary meeting. So my thought was to go through judiciary since it is a legal issue and he's already there instead of paying him to sit in on our meeting as well. So that's why I suggested going through them with it. I'm not sure if you've talked to Nancy or not about it, but that's why I did what I did.
Speaking of
Anybody-
Nancy,
What's that, Randy?
speaking of Nancy, her meeting was supposed to start 6 minutes ago.
Okay, we're gonna continue on then, unless anyone else has anything on the chief's business. Okay, we're gonna go up to old business. Will wanted this kept on their discussion of concerns regarding the waterfall park. Will?
I just want, real quick, I just want to get everyone's consensus. I've been seeing a lot of, we talked about signage as a possible solution, or at least a to our issue down there. So I want to move forward and draft something up that we can possibly spread and put out into Waterfall Park. Is everyone in accordance with that? Can I move forward, or does anyone?
So after last month's meeting, I put all of our suggestions in the form of an email and I sent it to the mayor. I sent it to Jim. I sent it to, I believe, Candace Carr. I'd have to look back and see. I'm not sure. I think I might have sent it to Chief Arzab. I'm not exactly sure if I did or not. I'd have to look back. But I did make all of our suggestions, which included the chief's ideas for more signage, better lighting, cutting back trees, and all that stuff. Randy did send me an email with some information. I also put in there, I think Dex wanted to make sure that if MWRD would do some patrolling or whatever, and other than an email I got from Randy with some additional information, I've heard nothing from anyone else. So
Neither have I, Jim.
yeah, you were in on that too, Will. I sent
yeah,
it to you, right?
Out of that list, I felt like the easiest one that our residents can say, why haven't you at least done this, is just signage. You know, simple signage there, you know, couple signs spread out, you know, yard signs, things like that, I'm going to share after this meeting. I'm going to share some photographs that I've taken from the internet that I believe that at least send the message that this council here, this committee at least, is making some type of attempt to move forward with that problem. That's all from me.
Okay, if you want to send that to me, I'll send it again to all those people and see what we can do to get some signs going. Go ahead,
Okay.
Dex.
This is Alderman Johnson. I kind of agree with Will about something to be done, but also we need to try to see what MDWRD going to do, because I know when they go in partnership with us, and if we don't take care of the grass or whatever the situation may be, they give us a second chance, and if not, we don't take care of it, we're double fined. And that's why I just wanted to make sure if they are part of it, that, you know, they do their part as well, because they tax us if we don't do ours.
Okay, I will forward my email again, which has that idea. It has, I believe Alderman Stevo suggested having them install security cameras. That's in it. Broken glass, amount of trash in the park, all the Chief Arzab's ideas as far as signage, cutting trees, everything I just listed. That went, like I said, I sent that email on August 6th, and it went to the mayor, Candace Carr, Fred Bellato, Mark Miller, Will, Chief, and Jim down at Public Works. So, and the only thing I got a response was from Randy, which is a copy of the lease and an aerial view of the property. And that's where it's gone so far. So Will, if you want to send me whatever pictures you got, I will attach it to this and forward it again and ask somebody to start doing something about this.
I'll do that. Thanks, Jim.
Thank you. Anything else on the waterfall park? Okay,
Not
under
for
new
me.
business, Johnny wanted me to bring up looting / civil unrest plan. This happened a week or so ago when things started going bad in the city again. He suggested this. I did send a group text out to all you guys to say if anybody has any ideas that we could forward to the chief. Johnny's gone, so I really don't know where he wants to go with this, but I believe that the chief and the fire chief and the mayor and everyone have things under control and are figuring out what they're doing as far as if this stuff starts coming our way again. I know we've gotten emails from the chief that basically says they're monitoring things. So I wish Johnny was still here to talk about this, but since he's not, does anyone else have anything on that?
Chairman, I'd say this, Alderman Fahrenwald, I'd agree with you. I think that the chiefs, particularly Chief Arzab, seem to have things, I mean, they've got a good plan. It seems they do respond effectively. Yeah, I'm sure that they'd be open to any suggestions, but I don't have one.
Okay, well, if anyone has suggestions, they can email the chief or the mayor or whatever, and and that's what I told Johnny, and he just wanted to kind of talk about it a little tonight, but he's gone. So if no one has anything on that, we'll go to number 7, which is Alderman. Go ahead, Dex. Go ahead, Dex.
Alderman Klinker. The thing is that, the first responders are really stretched thin. I was there when it happened. I was on 119th and Western. JR kicked in. That was the reason why I suggested that Jim Postro have a person that's second in charge that's in the city to be able to help out in case of that. But, the Chicago's supposed to have been monitoring the social media, how this last outbreak happened. They wasn't monitoring it because it was all over social media, how they was going to plot, plan, and do it. But if there's anything that I personally can do, and the crew that I had down there at that McDonald's on 119th and Western, Chief Arzab, Chief Rita, do not hesitate to call me.
Okay. Anyone else on that?
Yeah, this is Chief Arzab. Just to I guess reassure a little bit. Obviously a lot of these situations unfortunately happen with no warning. But just to kind of reassure, not just for civil unrest or for looting, it's just for emergency things in general, such as large fights that we have to deal with. We do have protocols in place. We can call in surrounding towns to assist, state police, county. We have the ILEAS call out. Like I had mentioned in last month's meeting, we now have an officer getting ready to be trained to be part of that mobile field force with ILEAS. And again, we can call in additional manpower like we did when we did get looted, and then schedule it if it's known ahead of time. That's always a plus. Myself and Chief Rita, we are in direct communication with each other all the time. And we do have other agencies that are helping us, such as Department of Homeland Security, ILEAS. We have intel information that gets forwarded to us when it's available. So we keep monitoring that as well. And another thing that helps us out is the community and the aldermen, like they have done in the past. And I appreciate all of you guys that give us that information when you do know, because a lot of times you guys see more things on social media than we do. And just passing it along to us does a great benefit for us to at least try to look further into it to see whether or not they are legitimate concerns that we may have or may not have. So I just wanted to hopefully, reassure you that, we do have plans in place, but unfortunately the reality is sometimes, like it happened with Chicago, sometimes, we don't know until it actually happens, but we're as prepared as we possibly can be.
Thanks, Chief.
Yep.
All right. Anyone else on that topic? All right, we'll go to number 7, Alderman concerns and comments. I'm going to go with what's on the agenda first, since Johnny's not here again. He left. The 5th Ward Rain Gardens, which I told him sounded like more like a community development or municipal services discussion to me.
Chairman?
Yes.
Chairman, this is Alderman Carr. I did talk to Mark Miller today, and the Green Plum contract, somehow it got lost between the Finance Committee, the Finance Department, but it was voted on last Tuesday at City Council.
Yeah.
to approve it, and he said that she would be able to start as early as tomorrow to clean those rain gardens up.
Beautiful. Yeah, Johnny was concerned about the public health aspect of things as far as rats and things living in there. That's why he wanted it on the agenda. So, okay, well, I'll pass that on to him. Any other alderman concerns? Thanks, Candace.
Oh, I do have another concern.
Go ahead.
Chief Arzab, have we heard anything about Penny?
No, I have nothing no updated information, but I will find out and see what I can come up with, and I'll let you know.
Okay, I'm just wondering what's going to become of her van. I know we've gotten complaints on that. And
Okay,
you know,
I will try to find out something for you.
Yeah, we don't know if she's going to be released out back into the public, or if, you know, they're going to find a home for her to live in, or, you know, I don't know.
Yeah, I don't know either, and I'm not sure exactly what type of information they would be allowed to tell me, but I will do my best.
Okay, thank you.
Yep.
Any other alderman concerns? Comments? No? Okay. Next on the list is adjourn. Can I get a motion for adjournment?
I move that.
I'll second. Cazares.
Second by Cazares. I got to do a roll call on this. I'm sorry. So let's go. If you're in favor, say aye. Klinker, aye. Carr?
Aye.
Hill's not here. Johnson?
Aye, Chairman Klinker, and I think you're doing a great job.
Thank you. I'm trying. Cazares?
Aye.
Stevo?
Aye.
And Fahrenwald?
Aye, thank you, Chair.
Okay, so that's it. The meeting is adjourned at 7:16 PM. Our next meeting is September 15th